In Australia, random drug tests are carried out at alcohol checkpoints.
Just been stopped for a random oral fluid test.
Australians are doing it.
The results are shocking. 1 in 54 drivers test positive for drugs.
New Zealand doctors demanded it.
We want clean, sober drivers on the road. You know, you're driving a ton of metal and it's more deadly than any sort of weapon we have in New Zealand.
5 years ago, their wish was granted. The government announced random roadside drug testing would be a goer here. That proposed law was lead news with plenty of fanfare.
Kia ora, good evening. Drugged drivers are some of the biggest killers on our roads. Now, One News can reveal the government's introducing roadside testing to bring them into line with drunk drivers.
The saliva test can pick up drugs like meth and opiates, even some prescription drugs.
But that was 2019. Today, drivers continue to get high and drive. The road to get this legislation up and running has been rough, and there's still no roadside drug testing. This from last year.
The new drug driving legislation has hit a bump in the road.
The strategy's been postponed.
Drugs were found in nearly a third of fatal road crash victims in 2021, and the new legislation was touted as a key tool in reducing deaths.
So how are police supposed to enforce this law?
Good question. Now, finally, there's good news for police. The law should be passed by the end of this year. So what can they test for? Here's Simeon Brown, tough talking as Transport Minister.
A bunch of drugs such as cannabis, meth, cocaine. There's a list, I think, around 25 drugs. And of course, we know that drug driving is one of the biggest killers on our roads. Effectively, this gives the police another tool, but it also is a deterrent to say to people, well, look, if you are going to take drugs and then get behind a wheel, the police are going to have more tools in their toolbox to come after you and bring the full force of the law against you for undertaking this reckless behaviour.
But could this legislation ironically make our roads less safe? Those on some prescribed medications might trade something like medicinal cannabis that gets tested for something like a heavier substance that doesn't.
People will opt not to take their medical cannabis product and potentially take other substances that can be considered more impairing or heavier, so things like opiate-based pain relief, but that can otherwise, safely pass a saliva test. You're kind of getting a bit of a catch-22 where people might actually be putting themselves in more harm's way by excluding themselves from taking their medication as prescribed.
Kia ora, I'm Amanda Gillies, and on The Detail today, roadside drug testing. There have been plenty of false starts and negative tests, but now we have a positive. The legislation enabling the testing should be rolled out by the government by the end of this year, finally giving the police the power to randomly screen drivers for drugs. But what are the drivers' rights? How will it impact medicinal cannabis users? And how is it faring overseas? I spoke to Amy Haley, a senior research fellow at Swinburne University in Melbourne, Australia, where police have been testing drivers for THC, MDMA and methamphetamine.
Look, these tests have been used quite extensively by the Australian policing force and look, they have been useful in the sense that it's provided us a really good idea of the prevalence of different types of substances that might be involved in road trauma. And so for those reasons, it has been quite useful. But of course, we're sort of at this really critical point at the moment as we're looking down the barrel of legalization of medical cannabis. And so obviously what this does is it creates a little bit of an incongruence between how we're treating medical cannabis that contains THC, how it's currently treated as essentially an illicit drug, whilst also being a legitimate medication. And so I think this is where upon the problem lies. And I guess I can sort of foresee this becoming a similar issue for you over in New Zealand.
Because cannabis advocates, they say the devices are unreliable, the impact of the drug on driving abilities hasn't been conclusively established. What are your thoughts on that?
Yeah, so I think the question that's being asked is sort of twofold. And so on one hand, we've got the question of the presence of a substance. And so for that purpose, these tests are somewhat effective in showing the presence of a drug. And so they have built within them a threshold for detection for the drugs of interest, so whether that be THC, methamphetamine, MDMA, and they're able to show whether or not that drug is present in oral fluid. Now, that's not always straightforward in a lot of cases because people can take drugs at different times in different ways and at different concentrations, and that might show up differently for different people depending on a number of different factors. So whether you're a man, you're a woman, you're heavy, you're light, you've slept or not, you've eaten or not. And so that, in that sense, the test can show to some effect whether or not someone has taken a drug in some level of recency. What it doesn't tell us is whether or not that person is functionally impaired. And so the presence of a drug does not necessarily or reliably tell us or let us know whether or not someone is functionally impaired to the point where they cannot safely operate a motor vehicle. And so that is sort of where we're struggling at the moment here in Australia, is that argument of the presence of a drug equaling the intoxicating effects of a drug that means it's incompatible with safe driving. And so that is really the main issue that we're seeing. And so when we think about this in the context of medical cannabis, and of course this is going to be, I guess, relevant to all countries that are using these devices, if a patient is using a medicine, so medical cannabis product as prescribed each day, they will understandably have a traceable level of THC in their system. But whether or not they are impaired is an entirely different question, and it's impossible to answer that question in any reasonable way with a simple detection test like a saliva test.
Yeah, because it's used for cancer, for mental health, other pain relief. I guess, how do you protect yourself? Is it the simplest thing is don't get behind the wheel?
I think at the moment, at least for the patients that we've been speaking to in a lot of our research projects and people that we've just interacted with, so whether that be patients or advocates or healthcare practitioners, is the advice is simply to not drive, to abstain from driving. But that in itself is obviously very prohibitive and life-limiting for a lot of people. And driving is a really critical activity that people need to get themselves to doctor's appointments, to work, and all sorts of other activities, and just generally to live a life. It's really a sort of a crucial activity. It's not something that's sort of done without any thought. And so a lot of the times patients are, in our experience, sort of excluding themselves from a lot of these activities which would give them, access to entertainment, to family, to friends, just to live a normal life. And so there is really I guess an impasse at the moment with the way the legislation is treating people who are taking medication that is, prescribed to them legitimately from a physician. And we see that these kinds of restrictions aren't really imposed on people who are taking other medications which could arguably cause impairment. And so that these are things like benzodiazepines, even things like antidepressants. And so these medications aren't, followed up with the same sorts of restrictions that we see for people who are taking legitimate medication like medical cannabis for conditions, like you say, like cancer-related pain.
Gosh, because I know a woman who has cancer who takes medicinal cannabis for the pain, and it gives her some sort of relief, but she needs her car for her freedom and her life and quality of life. When you tell these people, best not to drive, what sort of reaction are you getting?
People are, I guess, most of the time people are reasonable, as in they are wanting to maintain their independence, and that's completely understandable. But they're also not willing to put themselves in a position where they're potentially going to be prosecuted for taking a medication that's prescribed. They're using it as prescribed, but all they're doing is driving. These people are often very conscious of not driving when they feel like they're impaired by their substance. But of course, the legislation as it stands is that it doesn't matter if you're impaired or not. It's more to do with whether or not the substance is present in your system. And so, people are sometimes self-excluding from driving, or in other cases, and perhaps more dangerous for medical conditions, is that people will opt not to take their medical cannabis product and potentially take other substances that can be considered more impairing or heavier, so things like opiate-based pain relief, but that can otherwise, safely pass a saliva test. And so people might be opting for substances that otherwise wouldn't necessarily be detected upon, but could be potentially more impairing. And so you're kind of getting a bit of a catch-22 where people might actually be putting themselves in more harm's way by excluding themselves from taking their medication as prescribed.
Amy, that is crazy.
Yeah, I know. It seems like it goes against, I guess, our knowledge of how these drugs work. It goes against our own understanding of people's, the way in which people take these medications, which is very responsibly. And people will only take as much as they need to alleviate the pain or any of the symptoms for which they're taking their medication. And something that's often not really explored or not really spoken much about is that oftentimes when people are taking medications, particularly for a pain-based condition, these types of medications like medical cannabis can actually help people perform or drive better because they're not in pain anymore. And so this might have, I guess, a beneficial effect on driving. But this is something that's really difficult to sort of show in scientific literature because realistically, the research is really only just catching up to us, what we know clinically. So we're doing a bit of a catch-up job at the moment.
What are Australian authorities, transport authorities, the police saying about this? Do they get it? They understand this loophole? Do they want to address this?
I think overwhelmingly the police have been proactive. And so I do need to give them credit for the conversations that they're willing to have with ourselves, so people in the research space about this, but also the discussions that have been ongoing with many of the advocacy groups, but also the policy and legislation sorts of discussions that we've been having. And so it does seem that we're having more of a collaborative discussion about how to best, I guess, first of all, protect patients, but also, my priority is to ensure that everyone gets home safely on the roads. And so that includes, everybody. I want people to be taking medication as prescribed, not just medical cannabis, but everything. You want people to make sure that they're safe. And so it's really just about involving policy and enforcement and research and advocacy in that discussion.
Say they get a fine and they get a charge and they appear before the courts. If they provide a prescription or anything like that, can the prosecution be thrown out? I'm not sure whether you can answer that from a legal standpoint, but is there cases like that where it's been thrown out?
Definitely not a lawyer, but I do know that as it stands, it's simply a case of presence. And so whether or not there are special considerations given to patients, I wouldn't be able to comment on that in any great detail. From my understanding, it's not really, it's not to my understanding that there's any sort of leeway or consideration given. It's essentially a matter of if there's a drug present, then that's going to be followed up with, every aspect of the law that it requires.
What about, can the tests tell the difference between, say, recent and past drug use? Has that been an issue at all?
The tests themselves won't be able to give us any sort of qualitative information. So the tests themselves will just sort of say on a yes or no or present or absent basis whether the drug of interest is detectable at the threshold which is, unique to the devices that are used. That kind of information, so that sort of detail about how long ago someone used a drug, whether or not it was, recreational or medical or what have you, that kind of information would only come from, having a discussion with the person in question, but also perhaps performing a little bit more of an investigation into other sorts of matrices, so things like blood or sometimes hair samples or urine samples. So the life of a THC metabolite can change. And so it depends a lot on sort of how long somebody's using it, how often somebody's using it, how heavy they are, whether they're a man or a woman. And so there's so many moving parts to that question that often a saliva test is insufficient alone to be able to answer that.
What other factors can sort of affect the reliability of these tests?
So some of the things that can affect it, as I said, so there's a lot of sort of individual factors that are going to affect it. So whether or not someone's had it their medical cannabis very recently. That's going to be showing up more potently in oral fluid. The type of medical cannabis that people are consuming is also going to have an effect, because a lot of these tests are quite obviously looking at oral fluid. And so, for example, if you're smoking or inhaling a cannabis product, a lot of the THC is going to leave residue in your oral cavity. So that's in your saliva, in the other parts of your mouth. Whereas people taking a capsule, so something that might be a gel capsule, might not actually show up just due to the pass through your gut, as opposed to it being absorbed into your saliva. And so there's a lot of different sort of factors at play here.
Sounds a little bit hit and miss, does it not?
It is look, it can be quite difficult. I think as we're sort of discussing this, it's obvious that there are a lot of complexities to this that isn't adequately captured by a simple roadside test. I think particularly in the context of medical cannabis, there needs to be a more nuanced discussion around, I guess, the doses that people are using, the reasons that they're using it, the recency, so how often people are, consuming this before they're driving, if they're waiting. So these sorts of tests are useful, as I say, for showing us on a population level more how many people on the roads might be using certain types of drugs. So it is useful for population-based assessments of the prevalence of a certain drug. So we can look at trends over time, but on an individual level, it's really difficult to get the full picture of someone's individual situation.
1 in 6 young Queenslanders has admitted to getting behind the wheel under the influence of illicit drugs. It's prompted fresh calls for mandatory roadside drug testing for drivers involved in crashes across the state.
Fatalities from drug driving is now equal to that of drink driving.
In 4 years, 267 people died in drug-related crashes. Those aged 18 to 24 are the worst offenders.
Every time a police officer attends a crash, they should be doing drug testing.
Just that overall picture, have you been alarmed or shocked at how many people have been caught with drugs in their system on Australian roads and sort of the fallout from that? And has there been a drop in it since these tests were introduced?
It's been quite interesting, actually, for myself. I do a lot of work with methamphetamine, and so we have quite significant issues with methamphetamine on our roads. And unfortunately, what we're seeing is that it's not that we're seeing this sort of overwhelming increase in the prevalence of drugs. It's more that we're not having a downward effect that we have seen with the types of strategies we've seen with roadside breath testing, for example. Those have been incredibly successful deterrent strategies in Australia. So, the roadside booze buses and those sorts of approaches have just been incredibly helpful in reducing road trauma due to alcohol usage. We're just not seeing the same sorts of downward turn with respects to drug use. And so that kind of tells us that the issue is much more complex than just a matter of simply deterring people from driving under the influence. It's encompassing things like socio-demographic factors, health factors, lifestyle factors. And as we sort of look more towards medical cannabis, this, of course, is a medical issue. If people are taking this medication as prescribed by a doctor for a legitimate health concern, as many people are, then this is not going to be an effective way for us to try and either count or determine whether or not this issue is going to have an impact on road safety, because it needs to be treated like a medical issue, because that's what it's being used as a treatment for.
Absolutely. Just when you touched on the alcohol then, though, how does sort of drug-impaired driving compare to alcohol-impaired driving, sort of in terms of risk?
It's difficult to say. A lot of drugs do affect driving quite differently. And so I guess specifically looking at things like methamphetamine, it's a really complex picture of things like sleep deprivation, acute drug use, really quite heavy use over time. And, a number of different health-related factors that are all sort of bundled up with that. With cannabis, quite frequently, I guess, or consistently, we see that when people are taking cannabis at the doses prescribed. So these are, significantly lower THC doses than people would take recreationally. So people taking medical cannabis are not trying to achieve that sort of high feeling that people do want when they're taking it recreationally. In that specific context, we're not seeing those kinds of increased risks of road trauma. And so when people are using it responsibly, it can be done so safely. But I do say that with the caveat that in Australia, at least, we are, again, quite sort of slow on research in this area because it's still relatively new in terms of its status as a legal medicine. But research from overseas has shown us that in countries that do and have legalised cannabis for medical use, there has not been an increase in hospitalisations, in road trauma, significant injuries and deaths as a result.
Amy, what is your message to New Zealand authorities ahead of the rollout of roadside drug testing here?
I think that it's going to be an interesting couple of years for both of our countries. I think we're both going to need to grapple with what to do around treating medical cannabis patients as the patients that they are, not the criminals that they're currently being treated as. It's important to get a complete picture of the situation in which a person finds themselves in, and again, to try and approach this in a collaborative way. So research has a place in policy, which has a place in enforcement, and so it's just important that that conversation is, I guess, collaborative and evolving to ensure that we're all sort of going towards the goal of ensuring safe roads and that everyone's safe and gets home safely on our roads.
In 2022, alcohol and drugs were contributors to 200 fatal crashes on New Zealand roads. The government says this simply isn't good enough, hence the adoption of a much harder line. It's expected police will undertake 50,000 oral fluid tests every year once the drug driving regime is rolled out. They can randomly screen drivers for drugs, similar to how drink driving is enforced. Drivers who refuse to undergo the test will be issued with an instant fine and banned from driving for 12 hours. It's all about improving road safety. That's all for today. The Detail is a newsroom production supported by RNZ and New Zealand On Air. Thank you to Amy Haley. This episode was engineered by Phil Benj and produced by Alexia Russell, Davina Zimmer and Gwen McClure. I'm Amanda Gillies. Matua.